what are some things that you think are differentiating factors, and you can't name more than three, I'm going to start with you, as to what you're looking for in the place that you'll be at after graduation?
I think mentorship is my number one for after graduation. I have lots of questions that I'd like to ask more experienced clinicians. I would say my number two would probably be patient population. I feel like at Rehab to Perform, you all do a great job of attracting what you all show. So getting the patients that want to get better through active exercise and from that foundational standpoint. And then I guess three would be finding a location that I would want to live in. So I'm from Kentucky, but I don't necessarily say I want to stay in Kentucky, but just finding a place that I want to live.
I would say number one is similar to mentoring, but I'll say education. For me, something that, just being completely transparent, that I struggle with right now is being able to speak patient language to the patient versus the verbiage that we learned in school. So education, I feel like a company that values education to the patient, but then also education to the employee. So education, company culture, I feel like there's a push to love what you do. And I don't feel like you have to love what you do. I don't think that most people love what they do.
I don't love what I do. Spreadsheets and numbers today, and that is probably my least favorite day.
I feel like you at least have to like it. And if you're in a company that the culture is good enough, the people are good enough, then it makes those bad days a little bit better. So education, company culture, and then if I had to choose one more, a place that I feel like there is room for growth, so that I can grow through the company.
Mentorship, I feel like we come out of school as entry-level practitioners, but there's still so much room to grow, and we come out of school knowing a little bit about every aspect of PT, but then we want to specialize and start to learn how to treat in whatever population we're interested in. So having the opportunity to just learn more about treating in that setting and with that population. And then the big one is also just opportunity for growth, and just whether that's a residency offered through the company or just whatever opportunities there are for growth, and just in the future opportunity to just keep going upward and not staying in the same spot.
I would make sure that all four of you know is it is good to have structured mentorship. It is also good to get good at asking for time. And when you do get time, then being very, very prepared with high-level questions. So look like you've done a little bit of the work yourself, look like you've sourced some of your own problems with your own solutions a little bit. People like to be a little bit higher level. So look like you've put some effort into whatever might be challenging you at that given time. I think that you'll find yourself in a better situation. The people that have grown the quickest at our company have taken advantage of the resources that have been provided to them, but then also have gone above and beyond with regards to asking people for time, potentially meeting people off hours. One of the things that I know some of the people like to do is, they might be going into work, and they might say, hey, call me while I'm driving into work. So meeting people wherever they're at. Mentorship is going to look different when you talk about those informal touch points for everybody. It's just a matter of kind of figuring out when and what that looks like with whoever it is that you're trying to potentially be mentored by.
I want to be somewhere that focuses on evidence-based practice. It was something our school really harped on, and I really loved it. They really taught us how to read a research article, which I think a lot of clinicians lack the ability to read it, analyze it, and interpret it, and create their own understanding of it and how they're going to implement it. So I think being in that environment will allow me to keep those skills and encourage me to do my own research working with patients. I also want to work somewhere where the clinicians prioritize their own wellness. So how are they taking care of themselves? They're not running themselves into the ground. Like, how are they filling their cup back up? Just because I feel like I thrive in those environments where if I see it, I will also do it. So if I see someone taking care of themselves, it almost motivates me more to take care of myself more. And then the last is being in an environment where everyone brings something different to the table. So I want somewhere where I can pick someone's brain about something, like maybe someone's a neuro, maybe someone's a cardiac, maybe someone's a power lifter, maybe someone plays a sport. can kind of get their knowledge and get their experience. You know, we're not all thinking the same. We should all be thinking differently.
Contrast, right? Diversity of thought. I think that's something that is underrated. Definitely not spoken about a lot. I think that if I'm being transparent, we will have conversations about different personality types and personality styles, a location. We have a kind of like a bartender designation for certain personality types. And I won't tell you on camera who's the bartender at which offices, but you need a bartender type at a certain office. You need other types in terms of how people operate, how they think, how they handle certain things, their ability to kind of flow and fluctuate with the people in the room. So I do think that's incredibly important. And then when it comes to problem solving, I don't think there's much argument to why more potential ideas would be a benefit. I think sometimes the challenge is then having people that understand that contrast is a very, very big benefit, diversity of thought is a benefit, and then also being able to move forward with one voice. So recognizing that sometimes, and that goes for myself, I might be on an island by myself, right, with certain things, and sometimes you have to realize that, and then sometimes you got to kind of find a way to come back to the group. But as it relates to the mentorship piece, and I forgot to mention this, if each of you were to go, and I'll remind you later, but rehabyourperform.com/mentorship, we have our first 15 months mapped. So you should be able to look at that. That is something that will go into R2B Connect. And even if you don't end up with us, it might be a good talking point to the next place you're at. And you could kind of say, hey, this is what I would like my mentorship to potentially include. Or if somebody asks you the question, what would you like your mentorship to look like? I would argue it might be a good talking point. And it's something, again, we'll be more and more transparent about what it looks like, because I think transparency is beneficial for everybody.